Hello and welcome. The most common reason for difficulty with balance is a loss of strength in the hips and legs. That may be due to illness, it may be due to injury, but most often the loss of strength in the hips and legs and the subsequent effect on our balance is due to a sedentary lifestyle. We're not moving enough. In this short clip, we're going to focus on just a few exercises that will increase the strength in the hips and legs and thereby lower the risk of falling. Let's get to work. Make sure that we're sitting close to the front edge of the chair. The feet are placed at hip distance. There's a slight lift in the breastbone to activate our posture. The head is level and centered. Now begin by bringing one knee upward toward the chest. Maintain the distance between the feet as we work. Work at your own pace. We're not counting the number of repetitions. We're just going to work for some interval of time that is appropriate to each of us, and then move on to the next piece. Now use the hand, if you need it, to bring the knee in a little closer to the chest so that we can also improve the flexibility in the hip. Keep the upper body straight. It's okay to rock a little bit, but notice if as the knee comes up, your upper body or head tends to tip forward. So try to maintain an upright posture as we work. Also, as I bring one knee toward the chest, I'm pressing the other foot against the ground lightly in order to increase the sense of weight in what will be the support leg when we're on our feet. Let's pause, reset the feet to hip distance. Now the next sequence is one of the most important pieces for increasing the strength in the hips and legs and also establishing the proper rhythm for standing and sitting. Right? Let's do a little test. Rock forward as you feel the head come over the feet, engage the legs, and stand. Do it any way that feels comfortable and safe for you. No rules. And come back down. Now, if that was difficult, if it was painful, if in trying to stand you weren't quite able to make it, you had to take a second try. And if there's distortion in the posture as part of the effort, for example, turning, pressing against the chair in order to try to get to my feet, then I need to correct that. And the way I do that is by adding a little elevation for my hip. Now you may have to experiment a little bit to determine what's appropriate. So add a little lift if you need it, and then try again. The effort should be smooth, and one of the most important parts of this is to have a clean chain of motion in our bodies. Feel it as the head comes over the feet. Each time we come to our feet, become balanced. Establish the balance before we come back down and repeat. The number of repetitions, the speed is not as important as the quality of the movement and the quality of our mental focus as we perform the movements. As we work, be aware. Be conscious of the flow of movement in the body. Be conscious of the pressure in the feet and the position of the feet, the space between the feet. The key to this is consistent repetition over time. And as we know, especially if there are joint issues, forcing it only makes things worse. And if we suffer a lot of pain after we've done this, it simply discourages us. So work into this gradually. If you're noticing that you have a significant weakness in the hips and legs. Now let's come to our feet. We may need a little support, so take a moment to position yourself behind your chair. I'm going to turn sideways for visibility. Set the feet to hip distance. The second piece to strengthening the lower extremities is to build strength in the calf muscles. So with the feet at hip distance, press upward into the balls of the feet, bring the heels up as far as we can, and then return to a flat-footed position. Use the chair for stability if you need it. This is not intended to be a test of balance. So if you can do it freestanding, that's fine. But if you're struggling to bring the heels up and you feel off balance, it is much better to make contact with the chair in order that we're able to get as much lift in the heel as possible and to slow the movement considerably. So I don't want to rush the movement, I don't want to come up in an explosive manner, but I want to come up gradually and come back to the ground in the same way. Finally, as the heels come to the ground, avoid tipping backwards and allowing the balls of the feet to come off of the ground. So lift and then return to a flat-footed position. If your calf muscles start to burn, you're at a limit, so stop and rest. Now, turn at a right angle to the chair so that one hand will rest comfortably on the chair back. Reset the feet to hip distance. Now, begin to lift the knee. And as we do that, obviously all the weight comes to one leg. The key here is to bring the knee to waist level. So it's not about how quickly we do it, it's not about how many repetitions, but it's about the quality of the lift and the transfer of the weight entirely to one leg. If you can do it freestanding, fine. But it's not necessary, because whether we hold onto the chair for stability or work freestanding, we're still pulling all of the weight into one side of the body. And that's the important piece. The goal is to be able to sustain this for 1 minute. Eventually, increasing the duration to 2 minutes. Maintain a lift in the chest. And just as we did in the seated position, notice if as the knee lifts, if the upper body's tipping forward. So it's better to slow things down and focus on maintaining a straight posture rather than rushing through the pattern and allowing some postural distortion to find its way into the movement. And let's pause. Now, return to a seated position. Reset posture. Reset the distance between the feet to hip distance. And pause for a moment. If your respiratory rate has increased, if you can feel your heart beating a little bit faster, then just take a moment to allow the body to equilibrate. Round 2. You knew it was coming. Feet at hip distance. Begin by bringing the knee up toward the chest. Now, one might easily think, well, there's a lot of other exercises that we could do as well to strengthen the hips and legs, and that's true. But part of the goal here is to keep it simple. I like the number 3. It's not an even number, but there's a certain balance in it. It has a middle, and it has two opposing sides. We're hitting the most important muscle groups that we deal with in balance. The lifting of the knee integrates the lower and upper body into one smooth, continuous action. The press into the balls of the feet builds strength in the calf muscles, which helps to protect us from falling backwards. Strong calf muscles are necessary to propel ourselves around in the world as we walk, especially on soft surfaces like sand or grass, where each step we take, a considerable amount of energy is absorbed into the surface when it's soft. And the standing and lifting of the knee, that pattern puts all the weight into one leg and forces all the stabilizing muscles to come into play. And pause it. Take a couple of breaths. Standing and sitting is a wonderful rhythm in the body because that same rhythm plays out in many different scenarios, such as bending over to retrieve an object that's on the ground. Let's begin again. Rock forward. Rise. Get balanced. Then bring it back down. Careful as we come forward not to drop the head too much. Keep the eyes up. The head tends to follow the eyes. So if I look toward the camera lens, that keeps my head elevated and actually decreases the effort required for me to come to my feet. Don't try to match my pace unless you're able to do that comfortably. But again, think about what is comfortable for your body. The interval of about 5 to 6 inches above the chair, right through this interval here, that's the tough spot. So we want to come through that smoothly on the rise, and that's why we may need to lift. And then as we return to the chair, we want to be careful that we don't collapse through that interval. So try to control the movement on the rise and on the descent. A modest goal would be to be able to do 6 to 10 repetitions of this movement in a 30-second interval. But that number is highly dependent on the state of health of a person's joints. So each of us really has to think about what is appropriate for our own bodies. Let's do one more. And pause. Take a few breaths, especially if you're feeling a bit winded. We're working against gravity. We're using all of the body weight, so there's actually considerable effort involved in this movement pattern. Now let's go ahead and stand. Let's reposition our chair for the calf lift. I'm going to change my position slightly relative to the camera so that you can have a front view of the movement. Remember, what I would recommend at home is face the chair so that both hands can rest comfortably, and then begin to press upward, come down flat-footed. Remember, avoid the habit of tipping backwards and allowing the toes to come up. So we want a secure base. as we return to the ground. Are your feet at hip distance? As I press upward into the ball of the foot, I'm going to bring the chest upward as well. I'm holding that high position for a brief interval. Be sure to maintain a steady rhythm in the breath as we work. If you're beginning to tire, stop and rest. That's the beauty of video. We can always hit the pause button. There are variations on all of these patterns, but for this purpose, I want to keep things simple and direct. That's fine. Now, take a couple of breaths. Depending on how confident you feel with your balance, one minor variation for the next pattern would be to take the chair and shift it to the opposite side, because that makes a difference in the support as we work with the next pattern, which is the lifting of the knee toward the chest. Let's begin. Again, check first to be sure that we're at hip distance. Remember that we're bringing the knee to at least waist level. As I'm bringing the foot to the ground, I'm sensing the space between my feet, that hip distance. As the knee rises on one side, does the support knee tend to lock, or does it remain unlocked as we come into a one-legged balance? That again depends on strength in the knee joint and also the health of the joint, especially whether there's pain. So do what you need to do. Again, I know I say this a lot. Work at your own pace, your own level of intensity. The key to this movement is to bring the knee to waist level or as high as you can safely. It'll get better with time. We're trying to sustain for roughly 1 minute. I'm not timing it, I'm estimating. But my pace is at about 1/1000 to 1,000. And bring it back down. Let's return to a seated posture. Now, if you're waiting for round 3, I'm going to leave a third round to you, because one of the most important safeguards that we have to keep in mind as we work with these patterns is the fatigue factor. And for the person who has been sedentary for whatever reason, this may already be quite a strain. If a person becomes excessively fatigued, the risk of falling increases dramatically. So again, as we close out our session, be mindful of your fatigue factor. And if you're starting to feel tired, especially if your legs are shaking, that's enough. It's time to rest. If you feel like you can do more, then I would invite another round on your own. Let's pause briefly. Let's reset the position of the feet. Let's energize the chest, sitting close to the front edge so that we're independent in our posture. Take a couple of deep breaths. If your heart rhythm is accelerated, sit quietly for a few more moments and allow your body to equilibrate. Thank you.